Hello and welcome to the Unit 2 presentation on the nursing process. So the nursing process is used to identify, diagnose, and treat human responses to health and illness. The nursing process is a tool used consistently and methodically with nurses with every patient encounter. It's essential that you learn and understand how to apply the nursing process. The next 3 slides are your learning objectives for this lesson. I would recommend reviewing each of them in preparation for class and for the exam. So like we said, the nursing process is used to identify, diagnose, and treat responses to health and illness. This differentiates the nursing process from the medical process, which treats the illness itself. Following the nursing process allows nurses to provide systematic, patient-centered care. The nursing process allows us, as professionals, to use our nursing knowledge, judgment, and experiences to cue in on patterns, signs, and symptoms that the patient show us. When we use critical thinking and clinical reasoning, we are better able to care for our patients. We remember our experiences, and these shape our future planning and analyzing of patient data. The steps of the nursing process can be remembered using the ADPIE acronym: assessment, diagnosis, planning, implementation, and evaluation. The first step in the nursing process is assessment or data collection. Assessment includes the physical examination along with observation skills. We want to look for cues from the patient. Does the patient appear short of breath? What is the patient's perception of the problem? What about the family's perception of the problem? It's important to always validate data to make sure it's accurate. Make sure your observations, what the patient or family is telling you, and what your physical assessment shows make sense with one another. Data clustering is a way of organizing data and grouping similar data. For example, lung sounds, respiratory effort, and shortness of breath could be clustered together. Analysis is looking at the data you've collected and applying critical thinking. What does the data mean? Make sure you have all the data you need to make the plan of care. For example, if your patient has a fever, do you have the results of the CBC? The WBCs, or white blood cells, would indicate infection if it's elevated. You also want to sort out the normal from the abnormal data and look for patterns in the data. This is another way to apply critical thinking. For example, the patient's blood pressure is elevated today, but his last 3 blood pressure checks were within normal range. Think about what that means. What might be causing the elevated blood pressure today? Maybe it's medications, or his diet, or emotions. There are 2 types of data, subjective and objective. Subjective data is what the patient or family reports. These are the symptoms. This is charted the same way it's reported, using the patient states and what they state in quotations. Objective data is what you observe during your physical assessment. These are the signs. For example, a sign of nausea might be retching, while a symptom of nausea is the patient stating, "I feel nauseated." When interviewing, look for cues through observation. What is the patient's overall appearance? Introducing yourself and gaining the client's trust is an important place to start with the interview, because the patient's more likely to tell the details of their situation when rapport is established. Direct, closed-ended questions such as, "Are you having pain?" allow for a focused, quick assessment. They're to the point. Indirect, open-ended questions such as, "Tell me about how that made you feel," gives the patient opportunity to explore their feelings and explain what they need to tell you. It's important not to brush over questions. If a patient states he is not checking his blood sugars at home, figure out why. Ask if the glucometer works. Does he have lancets? Does he have medications? Does he take them routinely? Or what type of diet does the patient follow at home? So take a few minutes and stop here and answer these questions. Pause the slide and think about the answers before moving on. Alright, so you've analyzed the data you've collected. Now comes the step of stating your conclusions in the form of a nursing diagnosis. It's important to use nursing diagnoses and not medical diagnosis. For example, a headache is a medical diagnosis, so your patient's here for a headache. Well, you develop a plan of care for that information, and after your interview and exam, you develop your nursing diagnosis problem. Rather than a diagnosis of headache, a nursing diagnosis would read acute pain. So how do we separate a medical diagnosis from a nursing diagnosis? Well, medical diagnoses relate to the disease processes and their pathology. It's outside of a nurse's scope of practice to form a medical diagnosis. Nursing diagnoses describe how a person responds to their health problem or life process. This does fall within the nursing scope of practice. There are three types of nursing diagnosis. An actual diagnosis means the patient has the problem. So for example, the patient has a headache right now. So the diagnosis would be acute pain related to complaints of globalized headache, as evidenced by rates pain as 8 out of 10. An actual diagnosis must be in PES format, so it includes the problem, what contributes to the problem, and the signs and symptoms of the problem. A risk diagnosis means the problem has a good chance of developing, but it hasn't yet. So for example, a patient who is immobile is at risk for skin breakdown. So the diagnosis would be risk for impaired skin integrity related to immobility. Note that we don't have the signs and symptoms at this point because the problem has not actually taken place or hasn't actually happened. A wellness diagnosis focuses on a patient's strength. For example, a newborn with a feeding disorder. The diagnosis could be readiness for enhanced family coping. An example of an inaccurate nursing diagnosis would be lack of adequate nutrition. The diagnosis should be instead imbalanced nutrition, less than body requirements. Remember, a nursing diagnosis is not medical terminology, symptoms, patient needs, or treatments. This slide breaks down the actual components of a nursing diagnosis. We'll discuss this more in class also. So the problem is the patient's NANDA diagnosis. The etiology is what contributes to the problem and must be treatable by nursing. Signs and symptoms are the defining characteristics of the problem, not the etiology. So think for a minute back to our previous slide and just in your head think of what is the difference between a medical diagnosis and a nursing diagnosis. And can LPNs create a nursing diagnosis? Well, recall from scope of practice that the LPN can collect data, but they cannot analyze the data. So the LPN cannot make a nursing diagnosis, but they can carry out interventions falling within their scope of practice. So pause here for a minute and practice. Write one nursing diagnosis for a patient admitted with stroke and be prepared to share your diagnosis in class. During the planning phase of the nursing process, we write the care plan. Think of it as the playbook of nursing care for that patient. The nursing care plan is a culmination of data collected, which is your assessment, the nursing diagnosis, outcomes, nursing interventions, and evaluation of the interventions. It tells staff how to manage the patient based on the patient's individual needs or problems. Remember our discussion last week of Maslow's hierarchy of needs? Well, this applies to nursing interventions and care planning. We always want to attend high priority life or death needs first. These are any needs that would result in harm to the patient or others, such as respiratory distress or hemorrhage. Also consider what the patient feels is a high priority, because these are also important to the patient. Intermediate priorities are addressed next. These are things that are not life or death, but they should be attended to, such as imbalanced nutrition. Low priorities can affect a patient's future but are not pressing, so these should be addressed last. It's also important to consider the client priorities. What does the patient think is an important goal to achieve? Without a measurable outcome, it's very difficult to evaluate whether the interventions were successful or not. Outcome goals are broad, such as the patient will have a normal bowel function. Outcome criteria must be SMART, specific, measurable, achievable, realistic, and timely. And these are related to the signs or symptoms of the problem, or the S of PES. So if the problem is constipation and the signs or symptoms are hard stools, the outcome goal would be broad. The patient will have no signs or symptoms of constipation. The outcome criteria should be the patient will pass 1 moderate soft BM by discharge, rather than simply stating the patient will have a BM. Notice how much more detailed the outcome criteria is. This outcome criteria is how we know the outcome goal is met. Again, the outcome criteria is SMART and based off of the S, or the as evidenced by, and the outcome goal is broad and is related to the P, problem, in the PES nursing diagnosis statement. Nursing interventions are anything nursing staff does for the patient in the plan of care. Interventions should be safe and appropriate, achievable, in line with the client's belief systems, align with other therapies, and conform to the current standards of care. Each nursing intervention should be evidence-based and should include a rationale. Cite your resources to show that your interventions follow evidence-based practice. Evidence-based means there's research or evidence to support it. It also must be something that falls within the nurse's scope of practice. These are the types of interventions you develop in your care plan. Independent nursing interventions are interventions that nurses are licensed to implement based on their education and experience. Provider-initiated interventions are interventions that require a provider's order or protocol, but they also require nursing knowledge to perform. And then collaborative interventions require a multidisciplinary approach to complete. So implementation then is the action phase of the nursing process. This is where you perform the interventions you established, and it's collaborative. Performing the intervention allows you to reassess the goals. Make certain that the intervention is relevant and your patient understands what's expected. Be sure to document what was done. The nurse is responsible for teaching and the patient and family about the interventions. The care plan is designed to engage the patient in a partnership with staff to achieve goals. Engaging and involving the patient is patient-centered care, and it makes the patient more likely to be compliant with the plan. Tell your patient the goals. Provide rationales. A patient with severe surgical pain is more likely to cough and deep breathe if they understand that it's to prevent pneumonia, rather than if they're just told to do something that causes them pain. So again, take a few minutes to pause here and answer these questions. This is just to check your knowledge before you move on. And our last phase is evaluation. So evaluation takes place after the interventions have been carried out. Evaluation can only be done by the RN. It looks at whether or not the interventions were effective at meeting the outcomes as they were stated and on the date that was specified. Nurses evaluate whether or not nursing care was effective in meeting the patient's goals. The steps of the nursing process are reviewed and the care plan is revised as needed. Have there been changes that require the care plan to be changed? Have goals been met and can be dropped off the care plan? Outcomes that have not been met may have had the wrong interventions, wrong outcomes, or the interventions may not have been implemented correctly. In any event, they need their interventions revised. So just a quick review here. ADPIE is a good acronym to remember the steps of the nursing process. That concludes our presentation on the nursing process. Thank you and have a great week.